So with passive immunity, the immune system is not involved. We go around it. We take the antibodies that we've created in the laboratory or we've pulled out of somebody else's blood or whatever, and we give it to the person who was exposed to the antigen. It provides short-term immunity. This is what happens if you get a finger stick. You know, you stick yourself with a needle that you've just injected into somebody else's house, You go get a shot of the specific immunoglobulin to help protect you from getting hepatitis or to help protect you against getting AIDS. Not that that's 100%, but it really boosts your chances. It's a short-term immunity, and the types of drugs that give you passive immunity, the antivenins, that is, you know, you get bit by a snake or a spider bite, you can get an antivenin which will help prevent you from having a terrible reaction, and the immunoglobulins. With passive immunity, the serum or concentrated immune globins from humans or animals are injected into a person. So it's the immunoglobins. That's the key term you look for with passive immunity. The substances the substances needed to fight off the invading microorganisms are given directly to the person. The immune system is bypassed. This is short-lived, but it works a lot faster. Where do you get passive immunity? Well, there's naturally acquired passive immunity. That's what goes from mother to fetus through the placenta. If the mother has been around a certain kind of germ and has built up her own antibodies, she's passing it to the fetus, so when the baby is born, for some period of time, it is immune to those particular germs as well. Remember, this is short-lived, but in the immediate time after birth, she has provided that immunity to the baby. She does the same thing if she breastfeeds. She passes those immunoglobulins over to the baby. Then there's the artificially acquired passive immunity, and that's the ones from external sources. That's the injections we give people with antibodies or immunoglobulins. So why do we give people shots for passive immunization? Antitoxins, antivenins, immunoglobulins, they minimize the effects of poisoning by the venoms of spiders and certain snakes. It provides quick immunity before a person's own immune system has a chance to make the antibodies. So, you know, if you have a finger stick, first thing you're going to get is immunoglobulin to help fight you from getting the hepatitis B, and you're probably also going to get a vaccine at the same time. But the vaccine's going to take a while to work. In the meantime, this immunoglobulin can be taking over. Okay, adverse effects from active and passive immunity drugs. You know, they range from mild and transient, that means it comes and goes, to very serious or life-threatening. The minor effects can be a fever, a minor rash, soreness at the injection site, itching, but the severe effects can include a higher fever, like 103 Fahrenheit, encephalitis, convulsions, an anaphylactic reaction, dyspnea, and others. Are they common? No, they're not. They're fairly rare. And for the vast majority of the population, the risk of getting the disease is much more than the risk of having a severe effect. The consequences of getting the disease is much worse than the consequences of getting the shot for most people. Now, minor reactions we can treat with acetaminophen and rest. For the serious and unusual reactions, such as serum sickness, yeah, we're going to jump in and do a lot more treatments for them, but we also need to report it. via the Vaccine Adverse Event Reporting System. That's the VAERS. That needs to be done. This is the way we trace, are we having serious problems from this vaccine? Is it just the lot of the particular lot of medication that was sent out? This particular batch is bad, and they can track it and intervene or pull it off the market if they need to. Now, for giving vaccines or any of these drugs, obviously, we go back to all the assessed stuff. We check their history, we check what medicines we're getting, are they pregnant or not, how do they react to immunes in the past. We look, are they on an immunosuppressant therapy? If they are immunosuppressed, they shouldn't be getting those live attenuated vaccines. That is contraindicated. We're also going to look at the specific protocols for administration. There is more paperwork that has to be done because we do track these vaccines across the country and make sure we're not picking up any pattern of adverse reactions. And again, you're going to follow the manufacturer's guidelines for storage and administration. Parents of young children should be encouraged to keep a journal of what vaccines they've gotten and if they got any reactions and what dates they got the vaccines as well. If discomfort occurs at the injection site, you apply warm compresses and give Tylenol. But remember, we don't give aspirin to children because of the risk of Reye's syndrome. And again, we monitor for therapeutic response and adverse reactions like we do with all medications. Illness is caused by possible bioterrorism and chemical agents. Now remember, these are toxic agents used against populations. They're released and are there to create terror or kill or maim groups of people. What I want you to do is be familiar with the common, they're not common, but the known agents, and be able to identify, is this a biologic agent or is this a chemical agent? Biologic agents, those are diseases. Is it a disease or is it some kind of chemical?